All right, so now I'm going to talk about the muscles of the ankle and the foot. So we can talk about the muscles in the ankle of the foot. We can divide them into a couple different compartments. We can talk about the anterior compartment, which would be all the muscles coming from the anterior side of the tibia and the dorsum of the foot. We talk about a lateral compartment, so coming from the lateral side and kind of the lateral part of the foot. And then we can talk about a posterior compartment coming from the posterior side of the leg. And we also can talk about the calf muscles, which also are posterior, but are a little bit different from the posterior group. There's 10 muscles I'm going to talk about. They all have the ability to plantar flex or dorsiflex. So to think about, so that's the first thing you should think about when you think about a muscle. Does it plantar flex or does it dorsiflex? If it dorsiflexes, it's got to pull superior and from this anterior side. The axis of rotation for dorsiflexion and plantar flexion goes through the malleoli. So if you can just imagine a line through there, is the line of pull above that, it's going to dorsiflex, or is it behind it, and then it's going to plantar flex, okay? Most of the muscles have the ability to invert or evert. So a muscle that's going to evert, okay, that's when you pull the sole of the foot away from the body, that's going to have to pull laterally somehow, okay? And all your everters basically have kind of a lateral pull. If it's going to invert, and that's pulling the sole of the foot towards the body, it has to have some kind of medial pull. Okay, and actually most of your inverters are going to come from kind of this medial side. So the anterior compartment is your anterior tibialis, your extensor digitorum longus, and your extensor hallucis longus. So the anterior tibialis is going to come from the lateral part of the tibia and the interosseous membrane, and it's going to insert onto the medial cuneiform and the base of the first metatarsal. It's going to come over and kind of come across. So it's going to dorsiflex. It's your most important dorsiflexor. It is also an inverter. And it's really the only inverter that comes from this anterior side. And the reason why it inverts, again, if you think about that axis of rotation, it comes really far medially. Okay, so even though it comes from in the front, it comes really far medially, and it's going to turn the foot turn the sole of the foot towards the body. The extensor digitorum longus, that's going to come from the proximal part of the fibula, interosseous membrane, and it's going to insert onto the middle and the distal parts of the phalanges. So just from the name, extensor digitorum, it's going to extend the digits. So it's going to extend the metatarsal phalangeal joints and the interphalangeal joints. And it's also going to evert. Again, it's going to come over here, kind of on the lateral side. It's going to have a lateral pull, and so that lateral pull is going to make it evert. And then you have the extensor hallucis longus. Hallucis basically means big toe, so it's going to come from over here in the middle of the fibula, interosseous membrane, and it's going to insert onto the distal end of the first phalange, and that's going to primarily extend the big toe. Okay, that's its primary action. So just like the extensor digitorum, its primary action is to extend the digits, but both the extensor digitorum and the extensor hallucis longus, because they come in front of that axis of rotation for dorsiflexion, they will dorsiflex. Okay, so all three of the muscles of the anterior compartment, anterior tibialis, the extensor hallucis longus, extensor digitorum longus, they are all going to dorsiflex, but the anterior tibialis is the most important dorsiflexor. The anterior tibialis is going to invert. Okay, it kind of comes down here on the medial side. The extensor digitorum longus is going to come from the lateral side, and it's going to evert. The extensor hallucis longus, for the most part, doesn't do either. It kind of comes right over the axis of rotation. Newman says it doesn't do anything, and the trail guide says it's an inverter, but if it does invert, it doesn't invert by very much. And then the nerves of the anterior compartment, the nerve is all the deep peroneal or deep fibular, which is what Newman calls it, but that's all the same for all three of those muscles. Going to the lateral compartment, you have the peroneals or the fibulars, as Newman calls them. You have the peroneal or fibular longus that comes to the proximal the proximal 2/3 of the fibula. And that's going to come down and insert over onto the middle cuneiform and the base of the first metatarsal, and that is going to evert. It's also going to plantar flex. So both the longus and the brevis comes from the kind of distal 2/3 of the fibula, and that actually comes and inserts right here on the tuberosity of the fifth metatarsal. Okay, so they both come down here. They both hook around the lateral malleolus, which is really the bottom of the fibula. And because they come right behind that part of the fibula, right, they come right behind the axis of rotation. So they both can plantar flex, although they're not very strong plantar flexors. They're primarily known for their eversion. Okay, so you can see how with the brevis, it comes down here, down to this lateral side. It's obviously going to pull the foot laterally, okay, which is going to result in eversion. It's worth pointing out that the longus, which comes from farther up here, snakes down underneath and actually inserts to the same spot almost as the anterior tibialis, but it has opposite motions. Again, it has to do with where they come from, right? The anterior tib comes from in front, okay, but the longus comes from so far laterally, okay, and it sticks in underneath. It's actually going to pull. Pull the foot so the sole goes away, which is eversion. Okay, so even though they have the same insertion spot, the anterior tib, because it comes from here, is going to pull medially. The longus, peroneal longus, comes from over here. It's going to pull the foot so it goes the other direction. Okay, so anterior tib is going to be inversion, and then the peroneals are going to be eversion. And the nerve for the peroneals is the superficial peroneal. The posterior compartment is basically the mirror image of the anterior compartment. So you have the posterior tibialis, you have the flexor digitorum longus, and you have the flexor hallucis longus. The posterior tib comes from almost everything. It comes from the posterior part of the tibia, interosseous membrane, and the fibula, and it's going to actually insert onto almost everything. It's going to insert onto the cuboid and the navicular and the cuneiform bones, and basically everything, and then the second through the fourth, through the fifth, through the fourth metatarsal. So it comes head on here, attaches to almost everything. It's going to dorsiflex, or plantar flex, excuse me. Plantar flex because it comes behind that axis of rotation. It's also primarily an inverter, okay? So it's going to pull, coming from the back, it's going to pull the sole of the foot towards the body, okay? It's your most important inverter, posterior tibialis. And then your flexor digitorum longus is going to come from the posterior part of the tibia. It's going to come down to the base, down here to the middle and distal posterior surfaces, plantar surfaces of the phalanges. It's going to flex the metatarsal phalangeal joints and the phalange joints. And then the flexor hallucis longus is going to come from the posterior fibula and come to the base of the first phalange, the first phalanx, and it's going to flex the big toe. Both the flexor digitorum longus and the flexor hallucis longus, they can plantar flex. They're going to come from behind, and they also can invert, but they're not very strong inverters. So your really important inverter, again, is your posterior tibialis, but the flexor digitorum longus and the flexor hallucis longus can also invert as well. And the nerve for the posterior compartment is the tibial nerve. So the calf muscles also come from the posterior compartment. You have the gastrocnemius, which actually comes up from the femoral condyles and the posterior part of the femur and inserts to the calcaneal tuberosity via the Achilles tendon, and then, or calcanean tendon. And the soleus comes from the soleal line of the tibia down to the calcanean tuberosity or calcanean tendon or the Achilles tendon. So they both come in together to that thick tendon that comes down to your heel. They both are primarily plantar flexors. Newman says they can invert as well, but they're primarily known as plantar flexors. The big difference between the gastrocnemius and the soleus is that the gastric, because it comes up to the posterior femur, can flex the knee as well as plantar flex, whereas the soleus can only plantar flex at the ankle. And the nerve for them is tibial, as is the posterior compartment muscles. If I didn't say that, the posterior compartment, both the muscles of the posterior compartment and those calf muscles are all tibial. In fact, almost the entire posterior part of your lower extremity is almost all tibial. The other thing that comes up a lot with the calf muscles is the concept of slow twitch and fast twitch. You may have heard the soleus is mostly slow twitch fibers and the gastrocnemius is mostly fast twitch fibers. So when you do really quick movements that require a lot of energy tend to be more gastrocnemius, and slow movements that go for a long time, like posture, tends to be more soleus. All right? And those are the muscles of the ankle and the foot.